All right, so I added you on right now.
Yes,
Oh, perfect.
we're good.
All right, so start off with what do you got going on?
Okay, so how far back? I'm just gonna go total like plebeian style on you, like no clinical brain on. How far back do you want me to go?
What type? Well, first off, you're a PT, right? Then I'll start
I'm a
asking
PT.
questions like I'll start asking questions like I'll treat you like a patient, right? Um,
Perfect.
what types of activities do you normally do during the day?
Usually on any given day week, I'm prone to wrangle my four almost 5 year old. On a good week, I'll be doing some kettlebells. I've been doing that for more than 10 years. Brazilian Jiu-Jitsu, Muay Thai, and then I guess best described as trail running, but not on a trail, just on a local San Diego hill. Um, Most of my work is desk work or standing station work. I do a lot of multimedia stuff, social media stuff, work on the phone. Um, I spend more time in front of my espresso machine than I like to confess, though I'm still very proud of it. But that's generally it. I say I have a moderately active lifestyle, but when I am active, it's pretty intense.
All right,
It's warming up, so surfing's on the table now.
that's awesome. that is that's the lifestyle I think a lot of us, try to get to. But all right, so describe your symptoms to me. What are you feeling?
So I would say it was like Monday, Tuesday-ish. I had to do a lot of standing around for some reason, and like very static standing, like literally like standing around. And I usually walk around more barefoot, so I was wearing my sneakers. Not that I don't wear those very often. It's just that like I had a lot of standing to do last Monday, Tuesday, and I think on Monday evening maybe I started noticing that like my left toe, like the pad of the great toe, was a little bit just funny. Like it didn't feel numb, it didn't feel tingly. It just felt different, just a different sensation. I didn't really pay it any kind of mind because I kind of attributed it to, well, I was standing around a lot on Monday, but I had the same level of activity or lack thereof on Tuesday, um, and. Yeah, by I would say Wednesday morning, I suddenly realized I was waking up and my left toe was indeed numb, and I couldn't really feel most of it towards like the pad of the foot, up to like the toenail itself. On the top of the toe, I could feel it, and definitely once it got to like the joints of the foot, I could feel everything just fine. And I would say by about Thursday, Friday-ish, I felt a similar development on my right toe, but it never progressed as far. It was always just kind of the pad of the toe. It's probably worth noting that despite as active, intensely active as I normally am, for the last probably 6 to 8 weeks or so, I've been a lot more sedentary just because of life. Um, no doubt people are noticing I'm in a backyard, not behind a green screen, so I've had a change of environments, and so that required a lot of just sedentariness. And so all of a sudden, I think from sedentariness to maybe last Saturday, last Sunday, so maybe like 8, 9 days ago, suddenly getting pretty active again, but in splurts. That's the only true change of activity I can think of. Nothing's really gotten worse. Nothing's really gotten better. I thought this morning things were a little bit better, but then it wasn't. So it's kind of been kind of status quo for the last like 3 days or so. Yeah.
At any point, do the symptoms shut off?
No, the symptoms have always been on. I thought I was able to make it worse just by being weird, but it didn't really make it worse. uh, I think maybe like sitting, like compressing my hamstrings on like a very hard bench or hard chair. I thought it might have made it worse, but that didn't seem to do anything. And I thought a hamstring stretch made it worse, but it didn't make it worse. Nothing really made it stay worse or stay better. And actually, I can't even think of anything that actually made it feel better.
Did the hamstring stretch or the sitting down on the chair provoke it? Like, I mean, when you say worse, I'm thinking worse and it lingers worse. Did it provoke it and like make it a little bit more intense for that time?
Yeah, I would say provoke is a good term. So it did make it worse in that moment, but it didn't linger for much more than like a couple of minutes. Trying to hesitate using key phraseologies now.
And do you notice if there's any time during the day that your symptoms change for better or worse?
Um, I mean, I would say that like if like once I first wake up, I don't feel like it's all that intense. And maybe I'm just not as cognizant of it. I'm just kind of like, where's my kid? I got to take care of my kid kind of thing.
Yeah, right.
You know, so maybe just like a attention situation. But I can't really tell you if there's like a better or worse time, like morning's better, after a shower is better, or, like after I sit down or lay down on the couch for a little bit, it's better. It's just kind of there, and it's a matter of attention or not. Like I was wearing boots today and I kind of didn't feel it. And then I took off the boots and I was like, oh, there it is.
Interesting. And have you done any jujitsu in the past couple of days?
No, I haven't done any kind of jujitsu or Muay Thai, no martial arts, for probably the better part of 6 weeks or so. It's been painful.
Okay. Yeah, that's rough. It's funny. My wife and I were just talking that if I don't get exercise in, I'm grumpy. So I,
Yeah.
I get it. Any kettlebell work?
Kettlebell work, yes. Last Sunday, so a week ago, I was working on the barbecue, and intermittently I would swing just some reps, no more than like 40 or 50. I think at one point I did like a 100 rep, so like 2.5 minute swing routine. Did a couple snatches, did a couple clean and presses, but nothing that actually made me break a sweat.
Yeah. Now I've seen your videos, so I know you know how to do kettlebell stuff. So I'm not going to question technique. At least nothing was out of the ordinary that day compared to different techniques.
No, not at all. I mean, like, technique was fine. I was actually like, oh, like I thought I would feel a little bit of soreness afterward because it'd been sedentary for a couple of weeks, but nothing. I mean, I didn't feel like I overexerted. I didn't feel like I, tried to do some like weird windmill thing into a handstand and wreck myself. Like it was pretty normal.
Yeah. So Rob posted neural tension increase no worse with neural irritation already present, boots with higher heel. Rob, all that stuff is back there. I'm just waiting to try to bring it out a little bit further and see if there's any patterns. I mean, I'm assuming you know MBT, and I know you know of MBT. So yeah, I'm just looking for the patterns right now. So big picture, the swings didn't make it any worse.
Swings didn't make it any worse.
Not at the time. You didn't have symptoms because that was Sunday. Your symptoms started showing up during the week.
Yeah, I mean, and probably like, I mean, I don't know how much of this is like me creating memories now, but I definitely know that it was like Tuesday, Wednesday was kind of the window that I actually was cognizant, like, my toe feels a little weird. Monday, I mean, maybe at the end of the night, I was like, that's kind of strange, maybe it's because I stood on it all day, but yeah, it wasn't until about midweek, so 48, 72 hours or so after the kettlebell workout that I actually felt something was just generally off.
Have you tried any treatment?
I have not.
No
Nothing other than self-treatment, yes.
Yeah.
So
What have you tried?
So I've tried some back bends. I've tried some lower nerve tension. I've tried all sorts of, I tried quadrating, neutral gapping on myself. I almost convinced my wife to try to slam me for a roll, but she didn't want to play that game.
Did you try any
just twist me this way. Yes, I've actually tried some NSAIDs, so I tried some ibuprofen. More like psychologically prophylactic than anything else. I don't remember which extremity it was, but ages ago when I went from clinical care to clinical management, I want to say I had something that was piriformis syndrome-esque. I just forget which side it was. And I do remember that sitting provoked it, but it was definitely more in the piriformis region, not so much so distal. Like the highest I felt any symptoms might have been into like the lower third of the medial shin. But again, I'm wondering how much of that is just me kind of imagining like, oh my gosh, here it comes up the leg, that kind of stuff. But I've tried some McKenzie-esque, not specifically the McKenzie protocol or approach per se. I've tried hip flexor stretching, I've tried hamstring stretching, just general, like, if anything, it's not so much treatment as in I've been trying to provoke the heck out of this thing to see if I can make it any worse. What is this?
That was actually going to be my question. Did the hamstring stretches provoke it or anything?
No, I mean, if there was one moment that I felt like I might have provoked it was I did do repeated spinal flexion. And I thought I might have provoked it. I couldn't really tell you be sure. Like, I was like, hey, I wonder if I could, make this worse just by going forward and bending the crap out of myself. And I can't tell you that it's actually stayed worse.
Okay. And that was standing, I'm assuming.
That was standing.
Okay. So a straight leg. And so Rob, that kind of takes out that nerve tension thing, because if he's standing and bending forward, we expected that to provoke it. So that constant symptom, I mean, you're looking at, sorry, I'm throwing this out there now because you're essentially done with the first page of the McKenzie assessment. No red flags, no bowel bladder issues.
No bowel bladder issues to my knowledge, and
Are you waking up? Are your symptoms waking you up at night?
No, not at all.
Okay. Anything in your medical history that would lead to numbness, diabetes, anything like that?
No, definitely not diabetes. I know there's some, like, I'm kind of out of the age bracket, but there is like some risk of like heart disease, stroke on my maternal side. Last blood draw and full panel is, I think within the year, and it was all clear.
Okay. So red flags are gone. So now we're looking at distal symptoms down into the great toe. You could have localized ischemia down there. That's possible. You could have something coming from nerve roots, L5S1. L5 is going to branch out to the side first and then posterior as it comes out of the neuroforamen. Probably not something coming from distal to the spine, but proximal to the ankle. It's possible, but probably not. So, all right, let's start moving. If you were to just slouch, standing there and just slouch, does it affect your symptoms at all?
Knees locked or not?
Knees locked, yeah.
Okay. Sagittal, no. Nothing seems to be...
Okay, do you know how to do a Jefferson curl?
Not by name.
Okay, cervical flexion, thoracic flexion, lumbar flexion, all the way down, keeping the knees locked.
All right. And I'm showing off my lack of flexibility in the hamstrings.
I see that, man. Holy cow.
Yep.
Yeah.
That's all I got. I feel like very T-Rex-ish right here. Like, oh, I can't do it.
I was expecting you to get closer to 90, actually.
No. I have the weirdest lower extremities. I'm built kind of like a bulldog, where like my torso should be like 5'9", but my legs are more like 5'4". So that's why I'm 5'7".
And when you do this, does this change any symptoms?
I'm kind of curling. I'm barefoot right now. I'm curling my toes against kind of the concrete here, and I can't really feel like there's any difference. No. Nothing.
No symptoms.
No
Okay.
symptoms. No symptom changes.
Come on back up. And it's hard to do this one over the phone, but have you noticed any strength differences?
So I did test for that.
Yeah, perfect.
So like I test for great toe, and only in my brain I feel is there any strength differences. Nothing that I think if I tested on somebody else I would have noticed. I tested for both heel lift as well as foot drop, and there's nothing that's truly appreciable, at least not that I feel like I could have sensed if I was on the other side testing.
Okay, and no eversion. I don't know who tested you, so.
That was me.
Okay, so
yeah, it was just me kind of going, okay, I don't really feel like, I didn't feel like it was significant. Like if it was appreciable, like maybe if I did like a pressure dynamometer type situation, I might be able to test some millimeters of, strength gain, but it wasn't like, strong and then, like it wasn't one of those guys.
Okay, and go ahead and do some back bends. Can you churn sagittal again? Yeah, there you go. I want to see this.
Okay. All right, so here we go. How far back do you want me to go?
That's hilarious. You go just as far back.
I go that way just fine, right? I do have a history which goes back to like my PT origins of a back contusion back in like 2003, I think it was. And it was a bad snowboarding accident, landed, bounced on my low back after missing like a mogul type jump on snowboarding. But again, no problems there. In fact, I didn't even get PT for that. I got PT for my ankle from the eversion ankle sprain. But that would be like a injury history from way back. But it's never since bothered me since that time.
Yeah.
But that was my back bend.
Yeah, your back bend was probably a better angle than your forward bend. So Rob threw it out there that if not a derangement, more likely neural irritation or inflammation. And I'm at that inflammation portion because symptoms are constant, relatively unchanging over the course of time. Derangement, still haven't seen it yet. Derangement's going to be something that's fast changing. Still haven't seen it yet, and so you can't necessarily go there and pigeonhole it in there. And so I'm actually leaning more towards the inflammation than anything right now. Hard for me to say neural irritation because we can't really irritate it either. So nothing is really provoking them. And so that's why I was curious to see what happened when you took the ibuprofen, NSAIDs. But, it's that memory game. Did you really get any better? Was there no change? Hard to say. But right now, all of his history says something constant, more likely chemical related, and not necessarily movement related. But we're going to keep moving him just to see, right? So whatever our thought pattern is, we have to play the game out to figure out whether or not that's actually where this maze leads us to, or did we disprove something during our movement analysis? Do you know how to do a side glide?
Yep. Which direction you want? I forget it's always the opposite in your brain if you haven't been doing this for a little while.
So side glides are determined based off of where the shoulders go. So go ahead and do it. Which toe is worse today?
Left toe is worse than always has been. In fact, I didn't really feel like I had any kind of right toe symptom until maybe a day or two after I noticed the left toe in actual appreciable, like, oh, yep, no, it's there, it's numb.
Yeah, so go ahead and do a left-sided side glide. Good. Any change in symptoms?
I'm trying to determine if the change in symptom is because I'm not weight bearing on it anymore or if it's a true change. But I don't think so, just because I'm scratching. I'm doing the old great toe flexion right now just to see if there's any change in sensation. I don't really feel like there is.
And then what about the other side?
All right. So, all right.
Can you move to your right a little bit further? There you go.
All right. How's that?
Good. And then one more.
Sorry, go ahead.
Any change in symptoms with this?
You know what? Maybe a little bit. I might be dreaming it, but I feel like my right toe has better sensation. And I actually feel like my left toe might have a little better sensation in this position.
Okay. Go the opposite way again.
All right. Let's see. now I'm all confused. Like, did I just desensitize myself by like brushing the pad of my toe like 40 times? All right, let's see. Here we go. So going this way.
Okay. And does that change anything?
Perceptively, I think so. I actually feel like it did get a little more numb.
Okay. All right. So you're creating a change. At least you think there's something changing.
Minimally detectable, like enough for me to kind of scratch a couple more times on the concrete and go kind of, I wonder if it's a little worse.
Okay. Aside from anything subjective, you don't have any other objective measure in which to tell if you're better or worse.
Not really, because I can't. I don't know if I can. All right, let's see if I can do this here. Am I still in view?
Yeah.
Okay. Well, I can't really tell if, like, you can see me kind of resisting dorsiflexion here.
Yeah.
I can't break it.
Test eversion.
Eversion. Okay. Eversion. So eversion. Oh, pretty strong. I'm trying to heel hook myself. It's not working. No. Nope. Can't do it. Let's see. Great toe. I mean, if I really push it down, I can get it down there.
Yeah, but are they equal or not equal?
If I had to say, I feel like there might be like a plus sign in there. I mean, a minus sign rather, in the left. I'm also wondering if it's like.
Yeah,
a
hand
left
down.
hand versus
Right.
right. No, you know what? I would say, and I mean, now we're dealing with like, is my left hand better in abduction,
Right. Right.
adduction kind of thing. But if there is, it's like it's a minus sign. I'm fighting it pretty hard.
Okay. All right. And so there may be a difference, may not be a difference. And
Hmm.
so at this point, your best test is your subjective report.
Apparently so.
Okay. All right. So let's go back into that would be your left side glide.
Okay.
Other way. Sorry. Camera.
Right side
Yeah.
glass.
And when you
Okay.
do that, what happens to your symptoms?
All right. I'm testing. If anything, like I might be imagining this. I don't know if it's because I'm doing that much more weight bearing on the stance leg, which is the symptomatic or more symptomatic side. But I feel like in this position, again, I don't know if it's because I'm standing here. Like I feel like almost like a rush a little bit down the entire leg, but it feels a little bit more lateral, like anterolateral. But then as I'm doing the whole great toe pad scratch test, patent that one for me on the concrete. I feel like it's a little bit more present. Like it's not as dull, when scratching against this. It's not exactly like smooth concrete. So, this should be a little bit irritating. My right toe feels very much more sensitive in a good way. Like it had been kind of playing tag along to the left toe in terms of the intensity of numbness, but in this position, like I feel like I can feel most, maybe 80-90% of sensation, whereas has gone down to maybe 50 at worst, and the left toe has definitely gone to like 100% numbness over the course of this.
So the left toe is getting worse in this position. The right toe is getting better.
Left toe I feel is getting better, as well as right toe. Both are getting better.
Okay. All right. So now
my left leg is getting a little bit numb from just standing here and locking out my knee.
Yeah. Yeah. So now I'm actually going to throw this question back at Rob for a second and see what he's thinking, because now that takes us back to derangement. Hey Clay, you'll love this. So that takes us back to derangement when we start getting those changes. Hard to say because everything is subjective right now, but like I know what I want to do, and I start playing. So let's do left side glides, like 20, 30 reps.
You mean right? Mm-hmm. Left on your camera or
I want you to
left
go the
anatomical?
I want you to go the other way.
Okay. So you want to go into the area.
Yeah.
All right.
I always want to see, can I provoke it? Because if I can provoke it and then shut it down and I start seeing patterns, your symptoms are just a little bit too vague for me right now to say, all right, I got a slam dunk.
Yeah, it's been kind of weird. This is rep 6. I almost want to say I felt a little twinge on my right toe, plantar and medial aspect, just like a small little ping. As I'm doing this more, I actually feel like and again, this is all subjective, but I feel like there might be a little bit of numbness creeping up my anteromedial aspect of my lower third shin.
On your right side?
On my left, actually.
Your left side.
I don't feel like my right toe is better or worse. It feels pretty clear, actually.
So this is making your left side worse, right side better.
Yes, if we had to categorize. And it might be worth noting I did do self reflex testing. Obviously wouldn't expect anything from the patellar, but I was able to invoke just fine the Achilles. And this is really more of me kind of in the middle of the night freaking out, going, oh my gosh, is something terrible happening?
Yeah.
Are my reflexes gone? Or am I going to see like infinite amounts of clonus, like one of those clinical mental freakouts.
I'll be honest with you, man. It's like with all the responsibilities that we have in our lives, when something goes wrong, I go right to catastrophizing. I'm not even.
Oh yeah, no, it's like, no, I even went like, no, this is it. Like I have gout and Guillain-Barré right now.
Yeah.
It has to be the Mountain Dew. I shouldn't have drank the Mountain Dew. Something in there, just Guillain-Barré tomorrow, right? Like, maybe it was a cold I had. Like, it was one of those kind of things.
And so the more you're doing of this, would you say that there's any more change in the left side, or is it just kind of plateaued?
Trying to push it in there. Let's see. No, I mean, I think it's kind of plateaued off. It's definitely, let's kind of get back into camera view. I don't know how the resolution's playing, but definitely there's something like kind of here in like a, long oblique pattern that seemed to just be a little bit more numb, like just something kind of almost flushed the area. The toe is definitely not as numb as before we started engaging, and I don't know what to attribute that to. But it definitely felt like it got a little worse compared to the right side glide hold that you made me do.
Yeah, and so that's actually where we're going to go back again. So now let's go back to right side glide. One more time. Right lower extremity, would you say that there was any change with that?
With that, no.
Okay.
It's still as generally clear. Actually, no, I'm wrong. There was that twinge, but I wouldn't call it a true change. Like, I don't feel that same twinge lingering.
Okay, and then...
But rep like 8 to 12, somewhere there, I think I remember feeling a twinge going down to the right toe, just kind of like a little signal got sent down there.
And then on that right lower extremity, what percentage of normal would you say it is right now?
High 80s.
Okay. Yeah. So when you say clear, I'm like, all right, 100% good. So clear, high 80s.
Terminology, it matters.
So clear, high 80s.
I'm trying to be as like plebeian as possible.
Okay, now let's go back to side gliding to your right, 15, 20 times.
All right, here we go. All right, as we're doing this, I can't tell you that I had much change on my right. I feel like a flushing sensation on my left lower extremity, same area, that anteromedial aspect of the lower third shin. Doesn't really cross the malleolus. I might be dreaming that it's kind of following the medial archways, but I do feel like there is a significant clearing in the sensation of the great toe, reminiscent of, when your leg falls asleep and you finally kicked it back to life and there's that nice whooshing sensation that hurts like hell and then it's back alive.
Yeah. So like what we're hearing is there's a change, right?
There's definitely a change, and I mean, it's kind of bright now is probably a good description. That flushed area of the anterolateral lower third of the shin, like it's a brighter flushing sensation. I wouldn't necessarily call it numbing, because I can I just tap myself over there. I can definitely feel it. And in terms of like the patented toe scratch on the cement here, I'd say maybe 50% sensation is there.
Compared to
completely numb when we started.
All right. So, like, theoretically, we could end the eval right here. I don't ever do that. Because we're seeing, 3 o'clock seems to be a good position for you. 9 o'clock seems to be a bad position for you. Now, my question is 2 o'clock or 5 o'clock better than 3 o'clock?
Okay.
Sorry, when I say that, does that make sense?
It makes sense. So you want 2 o'clock versus 5 o'clock.
Yeah, so I want to look at 2 o'clock and 5 o'clock to see if it's better than 3. So I want to look at that anterior lateral component and posterior lateral component and see is it better than a pure lateral component.
Okay.
So do you know how to do flexion rotation, that knees to the right? Almost like that.
Oh man, you have to remind me of this. It's been I think 8 years since Mackenzie A for me.
Okay, that's cool. Tom, I'm glad to see that we're on the same page, man. It takes me back to the old study group days. Go ahead. If you're in a position, can you lie down on your back? Even if we can't see you, just follow through the directions, and we'll see what happens with nice.
Hold it.
When you said that's a nice patio.
No,
this is your backyard.
Oh, thank you. This is my backyard.
That's
I'll
cool.
hold it. Let's see if I need to see if I can actually do this without like this whole thing tipping over and you hear me exactly scream in terror that like my my phone is falling over because I'm kind of jury rigging the situation here.
Yeah.
Is it moving? I think it's okay. No, actually,
Yeah.
what would be smart of me if I rotated the phone, because there's that option. Man, that's embarrassing. Okay, I'm in view. I'm in view. All right.
So,
what do we need?
So lying down on your back.
Okay.
You're gonna bring both knees towards your chest.
All right.
Good. Let them fall
Maybe
off.
probably this way.
That's cool. Let them fall off towards the right, but you keep your shoulders down on the ground, and let them fall all the way down. Just let them relax completely.
All right.
Hard to see. Maybe bring your knees a little bit higher towards your chest. There you go. Good. Just like that. And keep that would be probably your right arm. Keep your right arm on top of your thigh. Yes, just like that.
All right.
And then make sure that your shoulders are flat. In this position, can you tell if there's a change in sensation at all?
I feel like my left toe is getting a little numb, just a little bit. And I can't really tell with my right, but I don't think it's better.
Okay.
But my left toe is definitely more numb.
It's definitely more numb.
Definitely more numb.
Then we're going to get out of this position and go down onto your belly.
On my belly. Oh, here goes the Bluetooth nightmare thing. All right, here we go. All right, on my belly.
And while you're on your belly, you're going to shift your pelvis towards your left.
Okay.
That'll work. And then hang out in that position. And
alrighty.
Can you tell if there's any change in sensation?
In this very moment, no.
That
actually, that was interesting because my left toe is like all numb again. Like truly, like I can only feel the, I can't tell if you can see it. Oh, you can see my knee bend back and forth possibly on the screen. But it definitely feels like I'm like banging the pad of my toe on the cement, and it doesn't hurt, and I can't really feel it.
And so in this position, is there any change? I mean, you say you still can't feel it, so I'm assuming no.
No, not really.
Okay. Can you prop up onto your elbows, maintaining your pelvis in that position? Good.
Doing my best.
And hold that position, and we'll see what happens here.
Okay. As we're talking, or as I propped on the elbows, I felt that flushing sensation again on the anterolateral medial aspect, or anteromedial aspect of the lower third shin. Man, I'm gonna get really good at saying that particular phrase. Trying to maintain this
it's hard to
here.
do if you don't have some sort of prop to keep that pelvis propped over.
Mm-hmm. So I'm just kind of like, I just keep kind of crawling my elbows away. No changes on the toe though. And so it's probably worth.
Toe is still 100% numb like it was after the flexion rotation?
Yep, toe is still 100% numb. Probably worth telling you that like my right toe is probably closer to 100 than it is 90 now in terms of restored sensation. So that's kind of cool. Like whatever we did on that long hold on the right side glide and into this, this almost 5 o'clock position.
Or the flexion rotation, because we did a couple of things though since
True.
Last asked that question.
True. But yeah, it's still a little numbish, but I'm definitely not as happy to bang it on the cement.
Okay, and so would you say that this position creates any change in that would be your left great toe numbness?
Nothing.
Nothing. So that's still 100% numb like it was flexion rotation.
Oh yeah. No, it's like very numb.
Very numb, but it's
very numb.
Right,
like you could poke it with a knife and I probably wouldn't flinch.
Okay, so let's go back to 3 o'clock. So stand back up and recheck your side glide off to your right.
What's up, everybody? Looks like we got a little bit more.
Yeah, more people are jumping on. I would say hi to everybody, but it's like my brain is trying to process all the information.
Okay.
I'm trying to see questions here.
Whew. I got them. I gotta clean this area up. Like, that's all dusty. All right, we're at 3 o'clock. Do you want me to repeat or hold?
Repeat.
Okay. I have Jurassic Park severely stuck in my head. because my kid's been playing the Lego Jurassic Park game.
Yeah.
And I was like, man, that was really good music. We need more movies like that, like just fantastic music like that.
Yeah, few and far between now. And the more you're doing, what happens to that left-sided toe?
Same thing, actually. That same flushing sensation, as if I feel like a lot of blood going back in. Like if I was sitting wrong, like in a bleacher somewhere. I feel like the toe is gaining sensation. Definitely not as numb, but definitely not as restored as I felt it was, to like 50%. But I'm less happy to bang it on the ground. Scratching the ground, I do feel like a little more texture now and pressure, but definitely not as numb as it was with flexion rotation, where I could probably stub it on something nasty and, you know, I wouldn't even know that I did it.
Okay, so Tom Lotus, he's on here. He says go ahead and flex. So Tom wants to see you flex 10 to 15 times. Let's see what happens.
Alrighty. Here we go. Outside of experiencing public shame of how how I need to work on my hamstring flexibility, I'm not really feeling any kind of change. Right toe is still very good. I'm very happy about that. Maybe like the very tip of the toe is still numb, but that's not new. The left toe, I'm just kind of going down and tapping on it a little bit. Doesn't seem to be changing too much.
Okay.
I would say it's maybe back to that like 50-ish%. I don't even know how many reps that was anymore.
And that's you gave us a bunch, not a huge change. So, like Tom, since you're on, this is awesome. I'm looking at loaded versus unloaded, and then gapping versus closing. So for left-sided symptoms, he seems to respond to right side gliding. Is he responding to right side gliding, or is he responding more to loading? And so I almost want to check 5 and 2 again in this position. So Ben, can you flex and reach towards your right? It's almost like flexion with right lateral flexion. Yeah.
So like so?
Yeah, I'll take that.
Is that correct?
Yeah, and just do 10 to, yeah, just do 10 to 15 of those.
On the way up, the second rep, I thought I felt a little bit of numbness ping into my left, but I'm checking it again, and it doesn't seem to have changed.
Aristide Dr. Dukes, he's a 6th-degree black belt in Taekwondo. He says, how are you going to land any head kicks with those tight hamstrings?
I'm not. I'm a Muay Thai Jiu-Jitsu fighter, man. I do knees, elbows. I'm not going to kick you in the head. I might kick you in the liver if you're like 5'10" and under. I'm not kicking any heads. That's what uppercuts are for.
And the more you're doing, what happens to your symptoms?
As I'm doing this, right toe is good. I might be dreaming, but I feel like my left toe it might be a little better. I have that same flushing in that whole medial anterior aspect into the greater toe, or great toe. Like I'm a raptor, I have several great toes. Still kind of numb, not worse.
Okay.
Like it's different. Maybe different better. Maybe I'm just reaching for any changes whatsoever. But definitely not worse. I don't nothing significant where it was like that side glide hold and I was like, oh my gosh, like I actually feel like I can feel, the sharp edges of this concrete more.
Right. And so and that's what I see is that we always have 3 o'clock right now to fall back on. And so that's why I keep going, because we found a green light in there. And so now I want to see is there a greater toe? Is there a better green light? So one more time, do a right side glide with extension.
Okay.
So there it is. I'll take that.
I'm still feeling that flushing sensation. I'm not sure that's actually gone away or if it's like pulsatilely coming back. But if I'm not dreaming, sorry, I'm gonna kind of just duck in the camera just to touch my toe. I feel like the more proximal element of the plantar side of the toe feels a little better. The very tip of the toe is definitely still quite numb. No pain whatsoever. Like I'm pinching. Oh wait, there's a little pain there. Once I really like grab my untrimmed nails and grab some flesh, I can feel a little bit of pain.
Yeah, we didn't test that before, so I don't know if that means it's better or not. But that's fine. We can use that. Go ahead and do the side glide, 3 o'clock, hold 2 to 3 seconds, back off 10 to 15 reps.
Okay.
And then go back and re-grab.
Draw some blood.
Right.
Yeah, I'm just going to grab my tomahawk over there and just, get the beard and start poking my toe.
So I'm curious. There's 16 people watching, but I don't have a timer going. Can anybody tell me how long this video has gone so far?
I can tell you too. Tap the little live button and survey says, I'm afraid I'm going to.
I got it. 45
okay.
minutes. All right, that's cool. I didn't know that trick.
Cool.
Okay. So 45 minutes. So theoretically, we could have stopped this eval when he said that he was better, right? And when he said that he was better, that starts to minimize the inflammatory classification, some sort of inflammation or chemical based as the primary driver and moves derangement up the list. Because we were leaning more towards inflammatory to begin with because of the history and the fact that he couldn't really change it. What's going on?
I don't feel like there's any kind of real changes on that one. I feel, yeah, like pain wise is what I mean. Like I'm grabbing good flesh and there's not much pain change. I can't tell you if it's any better or worse, or if it's one of those like we've been messing with it so long that like I can't perceive accurately anymore.
Yeah. And that's
definitely not as bad as it was in the flexion rotation position. Like that was like actively somebody could have slammed on my foot with like a hammer, and I'm not sure that my great toe would have caused me any problems.
Yeah. So the fact that we could create that type of change is the only thing that made me really start exploring again, right? And so if you were a patient in the clinic, what I would tell you is right side glides 10 to 15 times every 2 to 3 hours, assess for symptom change. Obviously, if you get worse, and I don't know what everybody else is like, but I tell them just stop. Here's my cell phone number. Give me a call, and we'll probably walk through a couple of things over the phone because we've already touched on a lot of stuff here during the session. Theoretically, we could have stopped at about the 30-minute mark and just stopped when you noticed that there was a change with symptoms, because that ruled derangement in at that point, and the inflammatory component started to take a lower rung on the ladder because we created a change. And theoretically, we shouldn't have created a bettering of symptoms in the inflammatory state. If we can change that
NSAID thing too, right?
Right. And so if we can change the symptoms and make them numb that quickly, either we're putting a ton of dural tension on you, which we didn't because you had your knees flexed, or there's a derangement going on. And so that takes me all the way back to that first classification. So yeah, now we're looking to see derangement. Is it conducive to movement or not? That's the last bit of this. Is we have a classification. Now the question is will you get better with movement? Will you get better with time? Hard to say, but the good thing is we know that a lot of these symptoms tend to get better with time. Right now, the question is this movement based or time based? So yeah, I'd give you that to do 10 to 15 every 2 to 3 hours, 24 to 48 hours. If you're not getting any worse, continue. Then I would see this patient again in the office. If you're getting worse, call me. So that's cool. Any questions from anybody out there? Rob, I know you were watching and we were kind of going back and forth on this. Flex them.
I'm trying not to screw up the broadcast by playing with the screen too much.
Yeah, so Cameron says, think side glides would be any different at a wall? Possibly. Always play with what we have, right? And so if he's doing standing side glides, sure, I'll take that. If we have a wall, you know, we might be able to get a little bit more overpressure against the wall. Hard to say, but the only way to truly know is to test it. And that's kind of how I operate in the clinic. I don't like to take guesses. It's either better or not. And, you know, if one thing made it a little bit better, you just saw me go through it there. If one thing made it a little bit better, can I change those variables in a little bit of a way to make it more better than it was with that first variable? And so then you would add in that second variable. And so I don't try to play with too many things at once I have a green light. And so if you have a green light, then you can continue to go. But if I wanted to know if he was going to get better still, I would play with the wall before I played with 2 o'clock, 5 o'clock. I would just continue to add more force. And so this is where we're at. And so if you have no additional force that you can add in, then you can, you know, slightly play different directions until the symptoms give you a red light to stop. Any other questions? Colin, welcome to the party, man. This is all because of you.
There he is. What's up, man? So I got a patient-oriented question for you, Vince.
Yeah.
So, you know, with all this stuff happening, you know, life-wise, and I mean, I was planning on taking like my normal 2-mile run. Like, do you feel as on the clinical, you know, provider to patient education side, how is that best communicated? You know, like, I'm eager to get back to running. I'm eager to test the water for surfing. I'd like to get back into Muay Thai. I probably won't do jiu-jitsu quite yet, just because everybody out there knows BJJ is hardcore, no matter what belt level you're at.
So yeah, again, I am like straight up systems and algorithms, right? It's the way my brain is processed. And so I start looking at, out of all the activities you just gave me, which one has the least amount of variables that I can control? And running is the least amount of variables that I can control, depending on whether or not you're running uphill, downhill, right? And so if you're doing more uphill running, you're going to end up going into a little bit more flexion. More downhill running, you're going to end up going into a little bit more extension. And so if I can control for variables, which I probably can't do in Muay Thai, I've never surfed, so like I don't have any relationship with that. So I have no clue what the variables look like for that. And so the first thing that I would tell you to do is, if you want to run, all right, go ahead and run. Pay attention to what happens when you're running uphill. And I would focus on just uphill, maybe uphill sprints, and go hard on uphill, but then really back off the throttle on downhill. Let's look at one variable. If you're going to be doing uphills and downhills, let's look at one variable and one variable hard and see if that variable changes anything. And if no change, and this comes out of a World of Hurt, if no change, or I think it's out of a World of Hurt, or it just came out of the study group. If no change and you're getting 3 green lights, meaning no worse, then add in the next variable. And you keep going until you've exhausted and you haven't hit a red light, nothing's made it worse. And then at that point, you would have added in all of your variables and you're back to normal life.
Sounds good.
Yeah, that's how I start talking to things with patients, just to get them back to what they're doing, but we have to make sure that in the process they're no worse.
Cool deal. Surfing is a lot of extension moment stuff because you're lying prone a lot. When you paddle, you actually paddle into an extended position just to have better strokes for position of the scapula. There's a lot of sitting around, which usually you're in flexion, however, because you're trying to grasp the board either with your legs or your hands or both. When you're riding the wave, which is really a short amount of time, even the best waves, I would say you're probably a little bit more flexion oriented than anything else. And there's probably, depending on if you're a longboarder or shortboarder, a good amount of torsional factors, just in terms of controlling the wave ride, very much like snowboarding, in terms of the mechanics and balance thereof.
So that I would probably go surfing prior to Muay Thai, but that torsional thing that you just said makes me a little bit more nervous because torsional made you worse immediately. So yeah, that's the only variable that I'm like a little concerned about adding in. Flexion and extension, I mean, you just loaded flexed and you loaded extended and no significant change. And so I'm not as concerned with loaded flexion and extension. Typically for a patient, I want them to see that it has no effect, right? And so I want them to play with the variables as much as they can at home and know that, oh, you know what, this doesn't make me any worse. This is one more thing that I can add into my routine during the day. If there's something that I'm questioning, then I rank them in order of, all right, let's try this one first, and let's build confidence, get some green lights, make you see that the body's robust and you're going to be fine. You're going to get back to it, and let's hold off on the torsional stuff. I wouldn't necessarily explain it like that let's hold off, but because you're a PT, you're going to understand. So I wouldn't necessarily say let's hold off on the torsional stuff, just because I don't want to induce that fear. But I would rank things in order based off of the amount of variables that we can control.
I think we should do a follow-up.
Yeah, I thought this was all going to be done through texting PM, and then Colin threw this out there. So.
I don't know, Colin, you jumped on. You unleashed the beast here. Well, this is always fun, I think. Like, I think it's always fun to have, like, a clinician-on-clinician session, and especially when there's just a little bit of role-playing involved and also, like, a real live case scenario. And there's always, like, a weird, funky, like, psyche, I think, when a provider becomes a patient and how much they try to either over provide on themselves or under provide. There never seems to be a good balance, because I don't think that's a possibility there, just because once you're trained, you're trained.
Right.
But no, that's awesome. It's really cool that we were able to tease that out. I did, just for a reference for everybody watching, either now or on replay, I did go through flexion, extension. I did go to 5 o'clock and 7. I didn't do flexion rotation. I don't know why I didn't. Just through like the series of it, probably because I never got to Mackenzie C. But whatever the case is, I think it's a good commentary to see like how quickly this can change. And even with somebody who, like, I consider myself pretty aware of my body, period. And I wouldn't say I'm overly aware where I'm just like, oh my gosh, there's that tingle on my fingertip. It must be a stroke. Like, it's not one of those kind of things. Like, I'm just, I like to be aware of life. And so with that, I think it's pretty cool to see this interaction on multiple levels, obviously the telehealth level, but also some of the hands-off just value that's brought by a sequence like this with the type of analysis behind it, where you're not grasping for things, and it's all about controlling things that you can and can't, and then limiting it to the variables like Vince was saying, so that you're not throwing a shotgun approach together, which I think is very easy to do in any setting. It's very easy to go down that route, and then not even on a desperation mode as a provider, but just because it's there, like just because it's available.
Yeah, and it's unfortunate because a lot of the patients don't know any better, and so they may not know that that there is almost that analytical, systematic side to it versus, all right, let's just throw 14 exercises at you. And I had a conversation with one of the PTs earlier today about this. Let's just throw 14 exercises and see what happens, right? Because it must be your core is weak. Yeah.
There's science to this, guys. There really is, and it's good. Vince, this is a public video, right? So we could probably.
I'm not sure if this group is private or not. I don't run the group, so I just do videos.
Oh, okay.
Yeah, it's not my group.
Well, if there's a way for us to export it, I think it'd be great. Just even with some show notes, or just invite the world. It'd be good just on like a provider to patient kind of consumer relations aspect, just to see this happen. Because these were really, they're very real symptoms. Like very, very uneven, abrasive concrete that I'm testing, sensation on and stuff. So. Cool. I would say, Vince, you want to close this out with any kind of final words of wisdom?
Yeah, man, this was awesome. Thank you for this. And like I told Colin before, I'm just riding coattails.
Thank you.
This whole way through. Just riding coattails.
Colleagues are all about collaboration. That's how I see it. I was like, you know what? Like, I got a couple of hours on everybody in Central and East Coast time, so I can be out here doing this thing, and hopefully it brought a bunch of entertainment and educational value to y'all, and You know, and personally, you know, Vince, thank you for your time. I know it's later there, and you kind of putting your clinical faculties on display in the hot seat, for that matter, live on Facebook. So I do appreciate it.
Yeah, thanks for coming on, everybody. Thanks for watching. If you can share this video, please. Thanks. Take it easy, Ben.
See you later.